Hello, my name is Carla Eckhart-Tadasena, and I am a proud member of the Board of Directors of 2020 Mom. As a former employee of the American College of Obstetricians and Gynecologists, and someone who has led practice management efforts for OBGYNs in large health systems, I know how challenging it can be to implement important new practices into everyday care. Today, it is my great honor to introduce Amy Ushry of ACOG. Amy is a registered nurse and staffs the Alliance for Innovation on Maternal Health, the AIM project. Today, Amy will be sharing the refreshed AIM perinatal mental health recommendations and the corresponding measures. I am sure that it will help all of us to improve our practice. Amy, over to you.
Hi, can you hear me?
We can hear you, Amy.
Okay, great. Thank you so much. All right. Hi, everyone. Again, my name is Amy Ushry. I'm a senior nurse program manager at the American College of Obstetricians and Gynecologists, or ACOG. And as Carla said, I work with the AIM program, or Alliance for Innovation on Maternal Health. And I just want to thank the newly named Policy Center for Maternal Mental Health for having me here today to share a little bit about the AIM Perinatal Mental Health Conditions Patient Safety Bundle. All right, next slide. Thank you. Okay, so first I'll briefly introduce the AIM program and explain what it is that we do. Then I'll move into providing an overview of the safety bundle. And finally, I will discuss some of the implementation considerations and challenges that occur when it comes to doing perinatal mental health quality improvement in the AIM program model. Next. So to briefly introduce the AIM program, AIM is a cooperative agreement from the U.S. Health Resources and Services Administration's Maternal and Child Health Bureau. It's an award that was awarded to ACOG, and our work demonstrates a national cross-sector commitment to promote safe care at every U.S. birth and lowering the U.S. rates of preventable maternal mortality and morbidity. Next. So the objective of AIM is, again, to reduce preventable maternal deaths and severe maternal morbidity in the United States. And we work to achieve this goal by promoting safe care for every U.S. birth through engagement of multidisciplinary partners at the national, state, and hospital levels, developing and providing tools for implementation of evidence-based patient safety bundles, utilizing data-driven quality improvement strategies, and aligning existing efforts and disseminating evidence-based resources. And the actual work of the AIM program is carried out at the state and hospital levels by state collaboratives who do quality improvement initiatives based on our AIM bundles with their hospitals in their states. Next slide, please. And so just to reemphasize, AIM is not just one entity, but it's a partnership involving our AIM partners and our team who help to promote the adoption of guidelines by incorporating them into quality improvement bundles or patient safety bundles. This partnership also involves perinatal quality collaboratives or other state collaboratives who serve as the coordinating bodies that mobilize hospitals across their state to implement the quality improvement projects based on our bundles, as well as the partnership also involves maternal mortality review committees, which provide the data that inform those state collaboratives about what aspects of maternal mortality that they should focus their efforts on. Next slide. So to show our reach, here's a map of AIM enrollment. We are in 48 states and the District of Columbia and engage many, many births across the country. And so our bundles and the quality improvement work that goes forth based on our bundles really touches many U.S. births. Next slide. We also have a data center because this is a data-driven quality improvement program, and hospitals and states are able to enter de-identified data and help drive quality improvement in that way. And this allows for within state as well as cross-state comparisons and allows for tracking progress over time. Next slide. So the patient safety bundles that I've referred to are available on our AIM website, which is saferbirth.org. These bundles are loosely built on the concept of bundles, which was coined by the Institute for Healthcare Improvement, or IHI. And the IHI definition of a bundle is a structured way of improving processes of care and patient outcomes through a small, straightforward set of evidence-based practices, which is usually about 3 to 5, that when performed collectively and reliably have been proven to improve patient outcomes. So AIM's bundles do differ from the original concept of bundles in that they are a bit longer, as well as they have space for different states to adapt their bundle to their own unique settings. And even though we encourage adaptability and tailoring bundles to each state's unique needs, the bundles still rely on established evidence rather than new practices. And they still call for certain basic actions to take place in patient care for every patient, every time, in every clinical setting. Next slide. So these bundles on this slide represent all of our core AIM patient safety bundles that are being implemented nationally. You'll see that sepsis and perinatal mental health conditions are our newest AIM patient safety bundle topics. And we're very excited that perinatal mental health conditions was recently released in January of this year. Okay, next slide, please. So for the structure of our bundles, they're typically divided into, or they've historically been divided into 4 categories, each with categories starting with the letter R, and those categories are readiness, recognition and prevention, response, as well as reporting and systems learning. But in 2020, AIM decided to go about revising all of our old bundles to include a 5th R of respectful, equitable, and supportive care, and make all new bundles built with this 5th R from the beginning. And the reasoning for that is just the recognition that respectful, equitable, and supportive care has to be embedded within all quality improvement. Next slide. So now I'm going to go ahead and transition, now that you know a little bit more about the AIM program, I'm going to transition into going into a little more detail about our perinatal mental health conditions bundle. And I do want to emphasize that bundles are really just one tool that are meant to be used in conjunction with many other resources and with clinical guidance. Next slide. Okay. So just to give a little background, the maternal mental health patient safety bundle, which is this bundle's predecessor, was released under ACOG's Council on Patient Safety back in 2016. This bundle utilized the former 4R framework, and while it had some elements of respectful, equitable, and supportive care, there was not a formal mention of it. This previous bundle was generally useful and very well received, but it also lacked some accompanying metrics, which are really required if we're going to use it on a large statewide scale as part of the AIM program, given that we are a data-driven quality improvement program. But in spite of this, we heard of many individual practices, sites, and even whole states who utilized this bundle and did quality improvement projects based on it outside of AIM. And this all pointed to the need to really revise this bundle and meet the needs of states and collaboratives who really wanted some sort of bundle to guide quality improvement around perinatal mental health. And so understanding that there was this need, there were many other exciting developments and progress and resources, we began revisions on this bundle last year with the goals of making any needed clinical updates, incorporating respectful care, developing metrics, as well as expanding the scope to include additional diagnoses as appropriate. And for the revisions of our bundle, we do work with groups of clinical experts, and we receive feedback from a wide variety of stakeholders, including people with lived experience, as well as the state collaboratives who are actually going to be helping to work with hospitals in their state to implement the bundle on the ground. Next slide, please. So to start with definitions, for the purposes of this bundle, perinatal mental health conditions refer to mood, anxiety, and anxiety-related disorders that occur during pregnancy or within 1 year of delivery, and are inclusive of mental health conditions with onset that predates pregnancy. And these conditions include, but are not limited to, depression, anxiety, and anxiety-related disorders like post-traumatic stress disorder and obsessive compulsive disorder, bipolar disorder, and postpartum psychosis. Next, oh, thank you. I will now quickly go through the elements in this bundle without reading every single one of them to you, but you'll be able to get an idea of our core items that are hopefully going to be implemented broadly as part of quality improvement projects throughout the country with participating AIM states. So in this revised bundle, we include developing workflows to integrate mental health care into obstetric care, including having screening tools and response protocols identified and ready. And we discuss including the patient and their chosen support network in the education and not just provider education. So really expanding our focus from our previous bundle to educate patients in their chosen support networks. Next slide. In readiness, we also discuss including trauma-informed care as well as anti-racist training in the provider and staff education, along with developing and maintaining referral resources and communication pathways between obstetric providers, community-based organizations, and state and public health agencies. Next slide. In our recognition section, we discuss having perinatal providers conduct validated mental health screening consistently through the perinatal period, with more specifics around the timing of depression and anxiety screening. And in our supporting resources and implementation guidance that go along with this bundle, we have additional details regarding specifics of that implementation. Next slide. So in the response section, which you can see some of our elements here have asterisks. That just means there is additional details in the implementation guidance that is also posted on our website. But in this section, we discuss initiating evidence-based patient-centered response protocols for positive mental health screenings, activating an immediate suicide risk assessment and response protocol for patients with suicidal ideation, significant risk of harm or psychosis, as well as we discuss facilitating pathways that allow for increased follow-up, communication, and coordination between multiple providers for people who are referred to mental health treatment. Next. Okay, and so in our reporting and systems learning section, which is important as it drives the data-driven quality improvement aspect, but we emphasize incorporating mental health into existing multidisciplinary rounds, as well as monitoring data that's related to perinatal mental health with disaggregation by race in order to evaluate for disparities and inequities in the processes of care. Next slide. Finally, and very importantly, we include respectful care elements in the new bundle. And these highlight the need to include every pregnant and postpartum person and their identified support network as respected members of and contributors to the multidisciplinary care team, and to engage in open, transparent, and empathetic communication with pregnant and postpartum people and their identified support networks to understand diagnoses, options, and treatment plans. And really, I can't emphasize enough that this is not just one piece of the bundle, but we really want this respectful care piece to flow throughout all of the other R's. We have been working on a change package to go along with this bundle, which will give more tangible recommendations for what teams can do. And in our discussions for the development of that change package, really the things that came to mind were the communication and were the provider communication with people. And so just understanding that this piece is just so important. So our data team, in partnership with subject matter experts, developed a data collection plan, which corresponds with our bundle and is also available on our website at saferbirth.org. And very quickly on the next slide, I'll begin to take you through some of the measures that are included in that data plan. But again, you can read it in its entirety on our website. So as shared, we have various different types of measures, and I'll start with the state surveillance measures. which seek to measure the first percentage of individuals with perinatal mental health conditions among all individuals giving birth, as well as the percent of individuals experiencing a severe maternal complication during the birth admission among those who have perinatal mental health conditions. Next. Here we have our process and structure measures that cover various staff education and percentages of staff who have received education on perinatal mental health conditions and on respectful and equitable care, who've received that education in the past 2 years, as well as the percentage of pregnant and postpartum people during the birth admission who have documented receipt of education on perinatal mental health conditions and on when to seek care before they get discharged. And then we have structure measures. You can read those. Hospitals and teams are able to rank their progress towards meeting these goals. And those are our structure measures. Next slide, please. We have some optional measures as well that collaborators can use if they would like to. And these include several screening related measures that are not intended to be used in place of HEDIS measures. So these are some additional measures that states can tailor their programs if they would wish to collect additional measures. And collaboratives also often tailor their own state data collection beyond even what the AIM program has put in our measures. So it is very tailored to each state. Okay. Next slide. So as you can see, we have many other bundle resources that accompany the bundle. Again, the bundle is just one tool. And so we also have a resource list that's forthcoming. We have implementation details, the data collection plan, and as I mentioned, we are working on a change package. Okay, next slide. So my last few minutes, now that you have a better sense of what's in the bundles, I do want to highlight a few of the complexities inherent with AIM bundle implementation in this model. So first, most AIM bundles have traditionally been used in inpatient settings. You can see that from our measures, which measure things that happen in the birth hospitalization. But we know that this care requires care across settings. And so it can be a little difficult to measure things and do metrics across inpatient and outpatient settings, especially for our states. And although there's been progress made here, states still really report challenges in linking data across inpatient and outpatient settings. Additionally, AIM is, like I said, just one tool. And while it's evidence-based, it's not designed to be overly prescriptive because, again, every state is different and has its own unique factors that make implementation look different. So next slide. And so last but not least, how can you learn more or get connected to AIM in your state? You can contact our national team directly at aim@acog.org. You can visit our website at saferbirth.org, as well as you can follow our social media channels, which can be found on our website. Next slide. Once again, highlighting that we are on LinkedIn, Facebook, and Instagram. All of those channels can be found at saferbirth.org, our website. Next slide. Again, I want to thank you for having me today to share a bit about this bundle, and I look forward to seeing any questions on the app. Thank you.
Great. Thank you so much, Amy. We are thrilled for your leadership. We're also grateful for HRSA, who we heard from yesterday, for funding this important program, the AIM program, and also the advocates that made all of these initiatives possible years ago. These maternal mental health refreshed guidelines through an AIM bundle. We've been waiting for quite some time, it feels like, here at the Policy Center. And so it's a real thrill to get to hear you present at the forum all the progress that's been made